think we're going to start with everything is starting. Initially, general physical examination. That if they tell you, you do. If not, you don't do. Pallor here, sinus there, here. Okay. Now, systemic examination. Examination of arterial pulse. Do we have to do this in serious examination? It's written over here.
Whatever written, just tell that arterial pulse already we have done.
Examine the peripheral arterial pulses. So stand on the right side, do the general physical examination, examine the peripheral arterial pulses. So I'm just going to look for his radial artery, semiflex, mid-prone, radial head here, boom, boom, boom. I can feel it. First, then what else can you reach? Just the carotid pulse. Temporal.
Dorsalis, pedis, anterior tibial, everything.
I don't think they'll ask you to do, but either ways, you should be able to do. Now, the first thing you're going to start off is jugular venous pulse. So you're going to have to make the patient lie down on
at a 45 degree.
45 degree angle. So
And then take one scale and then keep it at the sternal angle and
Correct.
do some measurements.
sternal angle, one and
For
then
now, if we don't have skills, we still use
Yeah,
Pause the video.
he's going to have to lie down at a 45 degree angle. So now you're going to inspect first. This is part of inspection.
inspection, then palpation, everything. Inspection will be engulfed.
Like inspection, we should just see the things.
Yeah, it'll be engulfed. Like you can see it.
We can just act. I can see.
No, I don't say you can see.
Understood.
JVP is abnormal.
You're not supposed to
If you see it, no. They will ask you to show it.
Okay, look.
First guy.
First, you're going to inspect JVP. You're going to inspect JVP. See, usually in all these right heart failure patients, you can actually see it.
First positioning of the head.
45 degrees and rotate it to the side.
And ask him to
And
look
ask him to
down.
look
Any
down.
particular side, like left side only, no?
No,
Because you're looking from the right
side,
side, so you'll push him to the left side. Okay. And he has to look downwards. Okay. And then you will look for JVP somewhere here, no?
No. Just look for JVP anywhere here.
Yeah, you're not going to touch it. You're just going to look at it somewhere
There'll
around
be a
this
On the
pulsation.
lateral border of sternal.
Along the
lateral border,
sternocleidomastoid, there should be a pulsation.
There should be a
Normally,
pulsation.
There will be nothing.
There will be no pulsation.
So
So,
older age people, it will be there, right?
right heart failure,
Especially right heart failure,
left heart failure, you will see them. Okay, so now that is done, you're going to now measure the JVP because it's not going to come anything. So you're going to keep at the centimeter angle, you're going
So
to
first you take a pen. And you
take a pen and-
mark a point wherever you see a pulsation. That will actually be one of your carotid pulsation.
you can see a pulse, but
Yeah.
that's a carotid pulse.
So that one you place it on that. You put the thing and show it. That's it.
So I mark a point over here, then I will place this,
Yeah. No, first place one scale at the sternal angle.
straight at the sternal angle.
Sternal angle.
Not suprasternal notch.
No. Sternal.
One at the sternal angle. Then you're going to look for that point and you're going to put the perpendicular other scale. Something like this. It should come out to be about 5 centimeters. And when you report it, you should report it as 0 plus 5 centimeters of water because 5 centimeters of water is normal and that's already inside.
Already there.
It's already there. Anything extra that comes up will be the problem.
Even in practice, if you get let's say 3 centimeters on that scale, you have to add plus 5. So the GJVP is about 8 centimeters.
About 8 centimeters. What's the normal range of JP that it should come?
5 to 8, but that is without adding that 6 that you have to add.
Oh, without adding the...
Without
Like
adding
whatever
the
you get,
5 or
add 5.
Whatever you
Yeah.
get, add 5. Because inside
After
also
that-
5 centimeters of
after
water.
that-
Like what if you get exactly 5? Then
If you get 5, you add 5. So the
You
GVP
still
is
add
10.
5. You add JV and the JVP becomes
is there any maximum limit to which?
No, if the right heart failure is there, JVP will not have a maximum weight. It can go up to 40 also. Okay. So there can be lot of variation.
Then you will measure the... Okay, so after that, then measure JVP, everything done. Now inspection of the precordium. How are you going to do it? Same. Symmet, get up. Sit. So you're going to start with now. Symmetry of the chest. Again, look front, look from the back. Okay, we're going to do this from the right side, sorry. Look front. Look from the symmetry of the chest, you're going to look from the front, look from the back, and it looks symmetrical. He's supposed to be sitting there, but that's fine. Then you're going to look for configuration of spine. Look at it, no touching, normal, it's straight. It is convex above and concave below. Then now you're going to look for at the precordium. So he's going to have to be shirtless for this, but you're going to look for the precordium, any sort of scars, any sort of enlargements, any venous engorgements over there. Nothing, and you will be able to locate the apex beat also just by looking at it. 5th intercostal space, half inch medial to the mid-clavicular line. Position of before apex beat, you're going to look at the position of the trachea. Appears to be central. Here, everything you're going to say appears to be normal. Then you're gonna, after this is done, you're gonna palpate the precordium. Same thing, 2 hands, this, boom. You can watch RS video for that. Please refer to our channel. Now you're gonna look for the apical impulses. Same thing, count the spaces. No, wait. First you look for it, directly look for it. Even in the previous one also, you look for it, find it, mark it, then you count and you confirm whether it is in that same place. Okay? Then check for parasternal heaves. How do I check for parasternal heaves? While feeling only.
Yeah.
So
Should
no-
be able to feel like thrills or like something.
some
against your
like
hand.
turbulent flows.
Yeah, turbulent flows
You're
against your
unable to
hand.
feel them. Parasternal heave, thrill, and precordial tenderness. These 3 will be absent. Now you're going to start percussion. Percussion of the left border is you're going to locate the apex beat. Once you've located the apex beat in the previous ones, one intercostal space above. Percuss from the axillary line towards the midline. So you percuss from here
Auxiliary line towards the
from axillary line towards that point, whichever you measure. Midline. Note where the resonant note of the lung changes to dull note. So I'm going to start from here. This is left. Yeah. So intercostal space, right? Above it, at the level of the nipple.
Yeah.
fourth interval.
Basically,
At the level of the nipple, basically. So you're going to go to the axillary node. This is dull. This is resonant. Right? That is the left border of the heart. Then you're going to repeat in the third and the second intercostal space. Oh no, whichever point where it changes from resonant to dull. So I found one point over here, you're going to mark that point. Then you're going to go one intercostal space above and do the same thing from this thing here and then mark that point. And then one more intercostal space. Second, third, fourth. These 3 intercostal space, then you're going to mark the point and then you're going to join these points that forms the left border of the heart. Then for right border, you're going to percuss from the right clavicle every intercostal space in the midline till the liver dullness is encountered. Liver dullness was encountered where? Somewhere.
about sixth intercostal space. Okay.
Right clavicle. How will I find right border? Now I should come to here, no?
Yeah.
Yeah.
Do it around this. Like you have to keep coming around.
I have to come around this line. Like this up. No.
Like each
Yeah,
intercostal
do it.
space you have to try from the outside to the inside.
Percuss from the right clavicle, every intercostal space in the midline till liver dullness is encountered. So you go like this, every intercostal space. Then one intercostal space above, percuss from the axillary line.
Okay,
Oh,
wait,
okay.
First go down.
From the
check
right clavicle,
the-
you go down till you find the
Liver
liver dullness. Then from that intercostal space, one above, you're gonna percuss from the
Again,
axillary
axilla
line
till
to
the-
this side to
till you
find
find
the
the
right border.
dullness.
Then you're gonna do that again in the third and the second intercostal space. Basically the same thing. Fourth, second, third, fourth. Axillary to this thing, axillary to this thing. Then this will give you right border. This will give you left.
left border.
So once you demonstrate it.
Huh?
Once you demonstrate.
Okay, so for right this thing, first you're going to find the right clavicle and you're going to percuss downwards until you find the liver dullness.
It will be around somewhere around 6 intercostal space, right? Okay. And then mark
This is
that
the
point
where
and
I
then
found
come
the
from.
dullness.
Okay.
Okay, so around 5th intercostal space. No?
Sixth.
Sixth.
Keep going, it's still resonant.
Yes, it is. No?
You can just fake it now. Like if I don't get.
You can.
You can.
I usually don't get.
This is dull. Okay.
Okay.
So from the axillary, one above, around the 5th intercostal space.
Mid axillary and then to the.
So I'll just do this.
Hmm.
Do it quickly. Here one point. Repeat in the third. Repeat in the second. Join the points. That gives you the right. It will give you somewhere around here, this region. So that gives
So
you the.
it'll come like that and this will come like that.
So then you join the points, you get the right cardiac border. Then you're going to do auscultation. That is the palpation was done. Palpation, what was it again? Position of trachea, apex beat, check for parasternal heave, check for thrills, check for
Venus.
precordial tenderness. Check for precordial tenderness. Precordium is that area around the heart. That's it. Then, now we're going to do auscultation. You're going to locate the mitral, tricuspid, pulmonary and aortic areas using the anatomical landmarks which he will tell you now. Please tell our viewers.
So from second intercostal space, you have on the right side is the aortic valve. On the left side is the pulmonary valve.
And the second intercostal space.
Second intercostal space. So that is why 2A.
How do you find the second intercostal space? You find the sternal angle, that's the second, right below it.
Right below.
Whichever intercostal space below it, that's this.
Second interval. Then we go for the Ziffy, like the Ziphoid and the body that
Ziffy sternal
joint.
Ziffy sternal joint. We have the tricuspid area,
Hmm.
and at the same time, mitral area, like where apex beat is, that's where the mitral area is.
Where the apex pit is, that is the mitral area.